Hey folks, my name is Jessica Mashkovich and I am the host of One Take with Jess. Today my guest is Toby Stark. He is broker and owner of Stark Associates Insurance Agency. He is passionate about educating and education, also passionate about the community. You're the youngest voted in member or youngest elected president of the Lions Club in Eatontown, yes?
Can you believe that was 11 years ago?
Really? Oh,
That was a long time.
see,
Yes.
I tried to do the research, the background, and
That's awesome.
You don't even look like you're so young looking. 11
So
years ago, you were the president of the Lions.
Yeah, could you imagine though, what I looked like 10 years ago, 11 years ago? Yeah. The
Like
meetings were fantastic.
What?
The meetings were fantastic. You could imagine the members looking at a 29-year-old, just like, we're going to do our own thing and you can try to run the meeting. That's how they
Oh my
were.
gosh, you probably had to serve juice boxes and cookies. But you know what? That shows you're a very community-minded, soft-hearted person that cares about people, not necessarily, selling a product. But you're here today because you are the industry expert of health insurance, and I have many questions. It's such a flawed system.
Yeah, well, I know we were talking about the hard stop in 30 minutes. We could actually expand this to about 2 straight days of conversation, and we still probably wouldn't even start off of the start line to move.
That's true. So maybe we'll turn this into a series. So this is, episode 1 of the healthcare series.
And I would tell you right now, I'm just looking at the date, October 1st, this is basically when most people start thinking about their individual medical insurance, or if they're on Medicare, what they're going to be doing with their plans coming up, or even larger organizations. Most renew on January 1st. So I would tell you that most people and employers don't love insurance in general, especially medical insurance, especially the rates, especially how the plans pay. So they block it out for 3/4 of the year, and then unfortunately have to take a hard swallow now and think about it. So this is our quarter to shine, basically, because every other quarter people are like, no, I want to talk, no. And I get it.
Yeah, I get it too. This is the time where I start looking at health insurance and the costs that we currently pay and what's to come, and I start cursing. And
that's a natural response.
It's usually the natural response to most of my quandaries, but I am legit befuddled, and I use that word like as a big umbrella to the whole entire industry. I don't want to call it atrocities, but the issues, the problems are so apparent, and the solutions have been, whether it's a political solution or it just seems that. Gosh, here's a statistic that I located in the summer newsletter of the New Jersey Association of Health Underwriters. The Kaiser Family Foundation found that the average New Jersey family pays a premium of $22,294 per year. Now, I can certainly agree with that because we pay over $19,000, almost $20,000. That's not even taking into consideration the deductible and copays on top of that. So we either are at that 22 or have exceeded that 22,000, and those are after-tax dollars. Right. Now, that is an individual healthcare policy, shitty coverage compared to what I had back in 10 years ago.
That's the common drumbeat of conversation, and people go, well, why can't I remember when I had, and I go, I know. And I would just tell you an aside for NJAHU, which is New Jersey Association of Health Underwriters. I was blessed, I guess, with serving on the board of directors for them and served as president a couple years ago. It's been 3 or 4 years now, and that's basically about 700 to 800 independent insurance brokers and the carriers as well. And what we do is there with NJHU is we try to inform consumers in layman's terms what's going on, and we also advocate for them, small businesses and individuals, to our legislators. So we do a lot of lobbying too, because they don't know. You're in your business, you're running your business. You hate medical insurance anyway. I mean, I should start that hashtag. But you don't like medical insurance, and then you get the bill for the renewal, and it says 17% increase, and you go, I didn't even use it.
And
And I
that's what
don't
it's
even
been like
understand.
every year over and over until it's creeped up to this high. Now, the problem is that, so there's a great disparity, difference between business and health insurance that you get offered when you work corporate and individual health insurance.
I
I
would
have
say
friends,
that depends. I
well,
would say that
yes and no. I have friends that work for corporate right now who
yes,
one of them pays $9,100 a year in
yes,
the health insurance plus dental. Those
yes,
are pre-tax dollars.
yes.
That means it's even less, like let's call it 7,000,
Hmm.
being generous, in as if it was, after tax dollars. But the idea that there's such a huge difference in working for a company, and you and I know the reasons, economies of scale, large groups, the benefit of being able to have an administrator of a group and offer, hand-selected policies that that are less expensive for a large employer to offer to their employees. But then now you're dealing with the fact that if God forbid you want to leave that company, you can't afford health insurance outside of that company. It's like stepping into a frying pan. How and why is your insurance so tightly tied in with the employer, and why is there no solution for individuals outside of that? There was and I'll have you answer that, but there was something called the association health plans, which were going to pull together groups of individuals with like interests.
Oh yeah.
I was a part of that with the Chamber of Commerce years
Of
ago,
course.
and then that went away. So
Yep.
I know that there's efforts being made outside in the individual realm, but it still pays to stay with that company, and it really hinders your ability to move around, for your employment and your growth in your career. Like, why are those two so tightly knit together, and why is there no other solution?
So I think it just depends where you come from. So if you're part of, and we use the word corporate, and I guess for your listeners and viewers, what defines corporate? Is that 500 employees? Is that 1,000 employees? Is it
Sorry.
mailman?
Probably.
Man, that was like, I was like, what is?
I think they were responding to what you were saying. Cooper, come over here.
Don't worry about that.
Okay, it's just.
So I think that a majority of New Jersey is small businesses, and a small business by definition is 2 to 50 employees. Once you get above 50 employees, and I would say in the hundreds of employees, it might make more sense for the employer to self-insure. So when they self-insure, they have to pay the claims on themselves. The carrier doesn't pay on behalf, they would just administer the policy. And what does that do? That enables the company to carve out some benefits that would be expensive, but they don't want to offer to employees. When you get to much larger corporations, like you said, the law of large numbers, you can spread the risk around. If you have 1,000-person company, you're definitely self-insuring, and you're going to be spreading that risk around. And you are going to be getting a subsidy, meaning the employee, from the company. They're going to pay for 50% of your benefits, 80%. Like you said, it's usually packaged, including dental and vision, and everything's tied up nicely in a bow. And those numbers, you're subsidized there.
Yes,
And you're like,
subsidies are great. When it comes to all of this stuff, even Obamacare.
Employer subsidization.
Yes, employer, but even the word subsidy, with Obamacare, it was supposed to be government subsidy,
Yes.
to make health insurance more affordable. But you either have to be working for a large company, sorry, my dogs are going crazy, or dirt poor, in order to have a subsidy. But there are so many small businesses, especially even mom and pop shops, that represent 64% of the GDP or 78% of the new jobs created.
Yeah.
And these are mom and pop shops that aren't able to take advantage of economies of scale, and sometimes aren't even able to get business coverage. Like my husband and I own our businesses. We are spouses that are we're not related, but we're spouses. That's a whole different part of the country when you're spouses and related.
Spouses and related, got it. Yep.
But that does not entitle us to be a two-person business, because apparently for business
rules have changed.
Yes, because it used to be, but now it's not. So now we're part of that group of people, and it's not even only in New Jersey. My parents also pay through the nose, over 20,000 as well down in Florida for
Yep.
health insurance. So, but you know, the fact that that you explained, you know, how and why that happens with companies and running their own policies, running their own and providing their own subsidies, that's great. But when it comes to, you know, health insurance and the fact that they can pick and choose as well what they offer and what they don't offer to their employees, we ran into that with what's it called, Hobby Lobby? Was it Hobby Lobby?
Oh yeah, with the pharmaceutical benefit for birth control, I think.
Yes, and I understand they're a privately owned company. They could do whatever they want, but their employees were now faced with, well, you know, I'm not going to have proper health coverage. So it gets from, it's almost like a division of church and state, in the sense that your career should be divided by, you know, from your health insurance. So you should be offered maybe a benefit like, hey, we'll give it to you cheaper, kind of like an employee perk. But on the other side, it shouldn't be 3 to 4 times more expensive if you opt out of your company plan, especially if your company plan is now having the, you know, power to decide what they're going to offer to you and what not, because of their, for whatever reasons, whether it's religious or ethical or, you know, whatever.
And I don't think that moving down to smaller companies, nobody generally, from what I found, dealing with groups or businesses and consumers as well. And we were talking about this before you recorded, but an independent insurance broker by definition represents the insured, or if they're not a client yet, the proposed insured, and leads them down the path to connect them with an insurance carrier. So they're supposed to be working in the insured's best interest. Even though we would get paid by the insurance carrier, we're supposed to find out what would be best for that consumer. So it's interesting because you say, do you bite the hand that feeds you? And I would say at times, because it depends. And in this world, it's so wild, things that come up. But the smaller businesses, they don't know what they have generally, unless they're using it and they're thankful for it. If they have a plan and they're paying for it, and then they have a deductible to pay, they're not happy because they're paying to pay, so they're paying a premium to pay. Now, on these smaller groups, let's say 2 to 5 employees, the smallest, we deal with a lot of them as well. The 2 to 5s, the employees are getting a subsidy from the employer, so they're entering into some type of arrangement, and this has gone way back with employer-sponsored health plans to make them more competitive and to bring on better employees, because it was always about, well, what are the benefits? What are the benefits? So one of the perks of working for a company that offers benefits versus one that's not is there's a benefit offering, but obviously it comes at a price to the employer and it comes at a price to the employee, and it could be significant depending. The employee generally, even though they get a notice of how much this employer is paying, they're not paying attention to it because it's just getting withheld out of their paycheck. And it might be 10%, it might be 20%, but whatever.
Right.
When they leave, like you were talking about, the company, then they can continue on state continuation, because if it's smaller than 20 employees, it's not federal COBRA in New Jersey, it's called state continuation. They look at the premium and go, that's how much I would have to pay if I want to continue on this plan. The employer says yes, do you want to or not? And that allows that employee to go out to the marketplace independently. Now, the plans may not exactly match up, and have the ability to get some type of subsidy.
But it's the same sticker shock. And when you say get some type of subsidy in the marketplace, you don't get a subsidy unless you are poor. And I'm going to use that word generally.
Well, can you define poor?
Yeah, I was going to ask you to define it, because I don't know what the threshold is for, you know, when Obamacare kind of kicks in with their subsidy. But
sure.
If you are talking about someone that, you know, went from corporate, who lost their job, they were making like 80, 90, 120,000.
Sure.
They're not going to qualify for any sort of subsidy, but now they have no job, or they may have to take a $40,000 job because they lost their job and the job market is as so. A $40,000 job is not going to even cover paying their health care as at the individual family plan, because we already established that's like $22,000, $23,000 after tax dollars. So $40,000 is just only going to cover.
It depends on a bunch of things. So New Jersey expanded Medicaid, and that umbrella helped a bunch of people that were kind of caught in a donut hole, which they were kind of working poor and they couldn't get that benefit. And I'm going to give you approximations on numbers. I think if you're one person and you make less than $21,000 a year or so, you would be siphoned off and going into being eligible for Medicaid. So basically the marketplace would say, our subsidy at the max, even if we subsidize this at 90% and your premium was just a fraction because the government's paying on behalf of you, you still, based upon your income, wouldn't be able to afford it. So here comes a social safety net onto Medicaid, and
Right.
that happens through the calculator.
And we're talking about, that's a different, portion of the population that is definitely financially challenged in that realm. But we're talking about the middle income people who, the situations which are more prevalent even right now, with the economy, how many people lost their jobs and are currently on COBRA, and then that's going to run out, and they're going to all be in the marketplace for insurance. They're not going to be covered by corporate, and they have to go to individual health insurance, and maybe have to take that job working at Home Depot because the only people hiring are Home Depot and Kroger's and Amazon.
Well, I think there's a little misnomer there, because when you go into the marketplace and enter your information, you're supposed to enter your aggregate gross income, expected income going forward. So if you only worked a quarter of the year, and we won't dance around the numbers, whatever, you may be eligible, depending, and everybody's a snowflake depending on their income and what they've lost. You might be eligible for a subsidy, so it never hurts to try. And we get calls all the time for people that either they got laid off or they're retiring and they're not yet Medicare eligible, and they have a COBRA package at $3,000 a month, or they have individual plans depending on could they qualify for a subsidy depending where they are. And that could be wild depending upon family size. It can go anywhere from $25,000 over $100,000. And New Jersey, or Get Covered New Jersey, I guess I'm doing a commercial for them, is taking over the federal government marketplace, or that many people call Obamacare. Mm-hmm. The term is Affordable Care Act, but the term that most people use is Obamacare. And really, people would say, I don't want that crappy Obamacare coverage. Well, Obamacare itself, or the Affordable Care Act, is just a mechanism to see if you qualify for a subsidy based upon your income. And once you go through that chute, you're going to wind up with a private insurance carrier like you would have before.
Correct.
Except it'll be subsidized by the government. So if your premium was $1,000, the government says, based upon your information, you can't afford that. How's $200? We're going to pay $800 of that. The carrier will still be made whole by the government, or taxes. And then the consumer will just get a bill for $200.
Yes, and that's a great selling point to the Obamacare type of scenario. But unfortunately, if you and I both don't know the thresholds to what that golden number is for income and which proportion of is subsidized going forward, of your plans, then we have to research that. I have to find out.
I would tell individuals, because there's a wide number, and I'm not going to hold myself to any particular number, that if somebody's eligible, or you want to put it in the show notes, there is a calculator, and that number is changing a little bit, and I'm not sure what it is because of the conversion of New Jersey taking over control of the federal marketplace. Mm-hmm. They're going to help with additional assistance as well. I would say for us, you and I, talking in New Jersey, we have been at a disadvantage because those were federal guidelines and federal income, and New Jersey is, as you know, a higher earner state. So some people that may qualify in other states probably didn't qualify because we're a higher earner in this state and would have to pay the quote unquote full premium like you were alluding to prior.
Yes, absolutely. And the full premium also includes the rates going up and up and up. I would assume correct. Is also from me subsidizing the others in the whole plan.
I don't think that it's directly correlated to your subsidy. The rates go up generally from an insurance carrier perspective based upon cost of care. And whatever the cost of care is, which, and you sent me how can we help with the cost of care and transparency. And I've been talking about that and trying to make a difference, especially with the association, for 11 years. And I would say, if you were a boat on a dock and you were going to take the rope off of the boat and start on your journey to get somewhere, I would say that in 10 years, I have probably not even lifted the rope off. I thought it would have been much quicker.
You're still tethered. You're still tethered to the dock on that one.
The transparency is very interesting, but what people pay directly, or consumers, are premiums, and they get fed up like you have and everyone else, and I'm used to it constantly, the expense of it and the increasing deductibles. My premium went up 10%, but yet my copay went up, my deductible went up, my maximum
and your coverage went down. Yeah.
Everything went up.
Well, and also healthcare facilities, hospitals, they're supposed to be making also efficiencies in the way that they run. Technology has made it easier to create MRI machines and all this stuff, and they have grants that are helping them do stuff, and research and pharmaceuticals. Yet, it's becoming too much for a lot of people, and it's backfiring because the health of our nation is extremely important. We saw with COVID, the need for your body and your immune system to be top notch is great.
100%.
Obesity is a challenge. Diabetes is a challenge. Low vitamin D is a challenge. All of these things can, the healthcare system should be able to support and highlight and treat these types of things so that we can be the best that we can be and be resilient and, try and resist some things with a strong immune system. Even dental care being separate from healthcare, your teeth, your dental health is very closely related to your heart health. How is that? If someone can't afford dental, now they're putting their health at risk for their heart. So does this mean that there's two things that come to mind? One is commoditize all healthcare so that we can pick and choose, and it becomes more like, which brand of shampoo do you want to use? They all kind of cost this much. The transparency is there, and then you plug and play, pick it off the shelf, plug and play. So commoditizing it is one thing, and the other thing is that was talked about is universal health care, and I don't even know what that exactly means. Or does that mean that our taxes, our federal taxes, will end up going up across the board? That somehow someone's got to pay for all of this stuff,
right?
But
so like you talk about universal health care, and that has been working in other countries. In the United States, we do have some type of universal health care, but you have to age in. You have to be 65, or unfortunately, you have to be on Social Security disability for about 2 years to receive your red, white, and blue Medicare card. And that is government insurance that you have paid into for almost your entire life. And actually, it is the best coverage you can get ever, better than any employer coverage, better than any individual coverage, but you have to wait till 65, and you have paid into it through tax withholding almost your entire life.
Okay.
Universal, the interesting part about that is, and I would just speculate from universal coverage, if the government was to pay, and we're talking about hospitals and primary care physicians and specialists, the private insurance carriers reimburse or pay the providers more than the government does. So Medicare actually pays less than a private insurance carrier, but it's usually bundled with a Medicare supplement. And if you're a doctor, your waiting room is not filled with 20-year-olds. That's just the aging process, that people that are older, that are in our social safety net of Medicare with a supplement, they need to accept Medicare. Even though it's less, it will make up through time. People hate to admit it though, it's a business too, it's unfortunate. But the problem is with universal health care, and I don't know how this will roll out, is the reimbursements would be significantly less.
Right.
So then hospitals would have to be much more efficient, or for lack of a better term, many hospitals will close because they will not be able to afford the reimbursements that the government may give them. And you and I probably both know, if we're going to the ER, we're reaching for our insurance card. I can't expect the general public to self-pay without insurance to keep these companies, keep the hospitals standing up on their own. It's so expensive as it is. And that's why insurance is there to begin with.
I have my $22,000 worth of insurance, and it still cost $1,500 to get stitches in my husband's hand last year. And I was like, I could have done it myself. Why did we even go to the emergency room?
Maybe an infection and a revisit, but yeah.
I watched a lot of MASH. I know how to like do stuff with military. Yeah. Grab the vodka, sanitize it, and get the needle.
Give them a wooden spoon.
Bite down
bite on it. Yeah.
I do know how to do a tracheotomy though with a ballpoint pen. I'm telling
thank you.
Years of watching MASH. But yeah, so even if you do have health insurance, it still becomes so costly to go to the doctor. I need, to go to the cardiologist every now and then, but it's not part of my preventative care. It's not kind of covered.
That's correct.
Right? Now I'm subjected to whatever they charge me. And then it goes back to the transparency thing. I can't ask my cardiologist, what is this office visit going to cost me? And then what if you, God forbid, give me like a Band-Aid when I leave? Like, what's the itemized costs of today's visit? And if I mention something, even when you go to the primary care doctor, if you mention something that's out of the realm, or if they test you for something that's out of the realm of preventative, you're now charged again. Like But you did mention also with Medicare that that's a very efficient system that covers an awful lot.
Well, I don't.
But I did want to mention the supplement part of what you still have to get if you really want good coverage in your Medicare days.
So Medicare is set up to pay 80%, and that's how it's been since its founding in 1965. So it doesn't pay for 100%, and you're left with a gap. It works well from an efficiency standpoint. I don't know. It is bloated with fraud, and they find hundreds of millions. I think the past 3 years, they found over $1 billion of fraud that drive up costs for everybody inside there, because just the government's slow to act. There was a primary care physician that was billing. We go to check out if they're really real. We go to the address, nobody's there. I mean, this is fraud is a big problem as well. So from an efficiency standpoint, I would say the beneficiaries that I help go into Medicare with a supplement, they thoroughly enjoy it because there is no $1,500 deductible. You don't have to think about anything. Does your doctor take Medicare? Yes. And then you just go. And then it's just taken care of, basically. You go to the hospital, you just go, I didn't see any bills. Right. So, but then they're willing to turn a blind eye because we work on this transparency leading up to 65, and then it becomes completely opaque. You have no idea. There is no delivery mechanism that would incentivize you to ask the questions that you would ask because you don't care, because it's not going to cost you anything. So now turn it upside on its head. You go, forget it, doesn't matter. So all the work that we do leading up to 65 is basically forgotten. If people are even asking the questions.
Well, I mean, that's really for the government to, if you're paying into the system and then, the Medicare kicks in, the Medicare people should be trying to protect their asset, and make sure that they're doing all the investigating. It's their product, so they have to make sure that it's not being scammed.
Well, let's just say there's no transparent. If you're a consumer, you just walk up with that creaky glass, slides open, and then you hand over your 2 cards, it closes, and then you just sit down, you be seen, and you leave. I mean, that's it. You don't ask.
It's not on the consumer, it's on the Medicare Association or whoever the agency is that runs it.
Well, historically, I mean, we're talking about consumerism. It would be important to ask transparency questions, but there's no incentivization after 65 to ask that. So why?
I can't even ask. I mean, it matters to me, but I can't even ask the question, because when I do ask the question, so you're talking about the Medicare consumer, it doesn't matter because whatever it is covered. For me, it's not. And when I ask the question, like, how much is this office visit going to cost, or how much is an MRI going to be? They're like, well, it depends what your insurance company is going to cover.
Exactly.
they have different prices for each insurance company. So there is a move in the industry to get more transparency of these costs, and there's also, pop-up minute clinics in CVS and
It's very helpful. Yes.
very helpful. And they actually plaster what the cost will be for that visit. Like they make the prices known as to what these medical costs are going to be. Stitches will cost this much, and a general visit will cost this much.
Yes.
There's pop-up places that are doing this.
I always urge my business groups, the ones that are paying to pay, like you, to, if they don't have to, and I'll never play doctor, even though I get asked questions all the time, if you can go to an Urgy Center or like a CVS, it will save you a ton of money. And usually the carriers will persuade you if you can. I'm not talking about extreme sense where you look and your arm's gone. You're like, well, let me just go to the Urgy Center. If there's a problem that's significant enough, they will send you to the emergency room anyway. But I always say, if you can, avoid the emergency room at all costs. Isn't that a shame though?
It is, because I'm still paying $22,000 or $19,000 to have that there.
Yes, avoid it. Avoid it if you can.
But have it there. So
the carrier will dissuade you.
I know that you said you had a hard stop at 11:30,
Yes.
but I'm going to ask you to wave your magic wand and put us in some kind of like what you've known as in your experience and representing the people and the interests, not necessarily the insurance groups, because I would assume universal healthcare kind of puts you out of business, or commoditizing healthcare so it's plug and play and pick it off the shelf.
Probably not. It would just change. We would still be relevant, but yeah.
So tell me what the wonderful scenario might be for individual health insurance, as well as the small business community that's strapped with trying to pull profit out of their business while just being in business in order to pay their large healthcare coverage costs, premiums. So what's your perfect world to help?
My perfect world filled with imperfections. I think that insurance at this point isn't going away because of the extreme cost of the big ticket items, the hospitalization, the possible outpatient procedure, things that are so expensive that you can't pay on your own. And I think that the mechanism at this point, which before wasn't there, which could, depending on where you sit, could help you with some type of subsidization, is probably at this point the only real avenue where you're getting assistance. We've gone down this rabbit hole. Premiums have continued to increase and cost of care has continued. And the direct reflection of premium increases because cost of care continues to increase with new technologies. And an example that we give in the Association of Health Underwriters, a colleague of mine, Dave Mordo, would say that if there was a baby in the NICU 25 years ago, God forbid, that baby might have only lived for 2 or 3 days. But now with technology, that baby could live for ever and be in there for 25 days. So the claim, unfortunately, is much longer. So coming with this technology is a larger claim. And then, of course, the consumers have to pay more. So from a magic wand, it's just a very complicated process. I think that we do have a mandate. I'm still waiting
for it. I'm still waiting for the
it's just to summarize, it's extremely complicated, and there's no magic behind it. It just takes a lot of, we're talking about GDP. A huge piece of the GDP is healthcare, and as I've experienced in the past 10 years, this thing just grinds. So I don't have any magic. I think that people getting assistance to pay for insurance helps, but I don't, unless we curtail cost of care somehow, I think that
So you think starting at curtailing cost of care is the start?
And I don't know.
So the middle class is still screwed.
What's that?
I said the middle class is still screwed no matter what.
Well, not just in healthcare. There's many other things. I guess we can do another podcast on the other stuff too, and that'll be out of my bailiwick, so it'll just be all opinions. Like my magic wand is an opinion too. I think that.
Well, you're an expert. You earned it.
I'm trying, but I do appreciate it.
Of the insurance industry.
I think we should, as we record, let's continue this. I'd like to attack some of the other, that we should have a good conversation on the other stuff too. I'd like to do that. And
So,
we're closing in on open enrollment, which everybody will be talking about. So Medicare is starting October 15th to December 7th. That's AEP, or annual enrollment period. And individuals that have individual policies that pay more and get less start November 1st. And a little public service announcement. It used to go till December 15th, so it was very short.
yep.
Since New Jersey has taken it over, they've extended that to January 31st.
I love that. I love that advertising tagline: "Pay more, get less."
The
Individual
unfortunate thing is we can only get as creative with 4 insurance carriers in the state as we possibly can. It's New Jersey is very ahead of the curve, though. And you mentioned pre-existing conditions. Since the 90s, we've eliminated pre-existing conditions, but everything comes at a cost. Like, I'm covered for mammographies right now. When am I going?
No, men can get breast cancer. That's good. That is good. As long as you're not covered for a pap smear, then I'd be a little bit.
They're called mandate. That'll be another show. It's called mandates, and that drives up the cost of care, the price of insurance. I'm sorry, it's a lot. But thank you so much for having me on.
Thank you. Do you want to mention your website or anything, or give your phone number just in case
somebody's listening?
Just in case anybody might be listening. Yeah.
Sure, you can reach me on my website.
I do this for myself, by the way. This is all to benefit me because
and that's fine. That's what we do. We help one person at a time. Local, you can call us at 732-747-0411, or you can visit us at stark-associates.com. Any questions, we're happy to help. We like to declutter the clutter, and unfortunately, some of the time you may not like what we say, but at least you know.
Well, I do appreciate you being on here. We only got to question 1.
Perfect. You knew that.
Of my 4-question series. So I'm definitely hoping that you'll hop back on with me again.
Definitely.
All right. Thank you. Have a great day. Love the background. Again. It's so calming. It made me feel calm each time I was getting excited with the conversation.
Oh, there's a boat. I was blocking the boat. There it is.
There it is.
Keyport, New Jersey, folks. There it is.
Keyport, New Jersey. All right. Thank you very much. Have a great day. Talk to you later.
All right. Bye.